what size Tarlov cyst would cause pudendal neuralgia? So Tarlov cyst is a meningeal cyst filled with cerebrospinal fluid. So what it means, it is a sac that is most frequently located in the spinal canal in the sacral region, which goes around the S1, S5 dorsal nerve roots. So the nerves of the sacral plexus run through that area, and there is thinking that those nerve roots may be compressed by those fluid-filled sacs. And some providers believe that Tarlov cyst may be a cause of pudendal neuralgia. So I did the study on Tarlov cyst, and it was published in American Journal of Obstetrics Gynecology in January of 2020, and the primary author on that study is Dr. Victoria Lin. And what we have done is we have the reason for that study was actually to prove or disprove whether Tarlov cyst caused pudendal neuralgia. So we have studied patients that came to our practice with pudendal pain, and those patients were getting MRIs, and we looked how many of the patients with pudendal pain actually had Tarlov cysts that were seen on the MRI. We know that in general population, approximately 4% of people have Tarlov cysts. So in our practice, in patients with pudendal neuralgia, approximately 16% of patients have Tarlov cysts. So that by itself may mean that there is some kind of a correlation between pudendal neuralgia and Tarlov cysts. So then we looked into laterality. So we looked into how many patients have a Tarlov cyst on one side and pain on the other side, or the opposite. And we found that in 50% of patients, so half of the patients had cyst on the opposite side than where the pain was located. So my conclusion from that study is that Tarlov cysts by themselves do not cause pudendal pain. But I believe that there is a common etiology between Tarlov cysts and pudendal neuralgia, because again, there is a much higher incidence of pudendal neuralgia in patients with Tarlov cysts. So there must be some common factor that patients are predisposed to developing pudendal neuralgia and developing Tarlov cysts. Now, I have absolutely no proof to what I'm going to say right now, but my thinking is that patients with Tarlov cysts and patients with pudendal neuralgia may have a weakness in connective tissue. And when they have weakness in connective tissue, they are more prone to form those Tarlov cysts. When they have weakness in the connective tissue, they also have weakness in the ligaments in the pelvis. So when those ligaments are weak, then the pelvic floor muscles are more likely to spasm, to stabilize the pelvis, to stabilize the SI joint. Therefore, those patients are more likely to develop the pudendal type pain. So I do not believe that there is any size of Tarlov cyst that is likely to cause pudendal neuralgia, because I personally do not believe that Tarlov cysts cause pudendal neuralgia.